I know point blank and first-hand experience what working with plants and dirt does for someone who is under stress of any kind. So when Ryan mentioned it, I just hopped right on board because I know exactly what it will do, and I know exactly how beneficial it will be for the St. Joe's community and the community in general.
It's cool that St. Joe's is so supportive of something like this, and cool that we could take an idea from a patient and within a fairly short period make something happen and have it living right now. It's pretty cool to see. So I think it speaks to where St. Joe's is going and how we really want to be not just caring for patients within the hospital, but also caring for patients outside of the hospital and making an impact in the community. Community members and patients and staff and volunteers who got together and thought that this would be a great idea, and the organization was very supportive of it. So this group basically organized what it looks like, making sure it's accessible, deciding on the design, and then we were fortunate enough to have some people helping us build it today. This year, because it's August, we'll probably be able to get in hopefully some leafy greens and maybe make some salads by the time the fall comes. There's actually, it's pretty cool, there's a community member who's a patient who actually is willing to take her tomato plants and transplant them into this garden. So you might actually have some tomatoes transplanted that we'll be able to harvest in September. We're fortunate enough to have green space out here, and I think that this will hopefully make this area a bit more of a meeting place where people can come and do something meaningful together without necessarily being in the hospital. So being able to come to the hospital to work on their health in a way without being admitted, or coming to a clinic. So it's kind of a different way to approach health within the community on the property of St. Joe's.